Good morning. Welcome
Good morning.
to Plastic Surgery 90210. I'm Ariel, and I'm here with board-certified plastic surgeon Dr. Katzen.
Hello, thanks
Hi,
for
Dr.
joining
Katzen.
us.
How are you doing today?
Good, and yourself?
Good, thank you. So
Good.
today we're going to talk about one of your specialties, well, two of your specialties, tummy tucks and body lifts.
Okay.
Now, many people don't even know about body lifts. Do they go by other terms?
Yeah, body lifts is a generic term. Basically, we're lifting the body, and that could mean a lot of things. Are we lifting the legs? Are we lifting the tummy, the buttocks, the hips, the breasts, the arms, the face? What's a body lift? So, sort of a generic term, and there's a lower body lift, which is the lower body, and there's an upper body lift, which is the upper body. So we're just going to concentrate on the lower body lift. Okay, so the lower body lift to me encompasses the tummy tuck, the hip lift reduction, and the buttock lift and reduction. So it's sort of like an incision that goes around your lower torso like a belt. Some people actually call it a belt abdominoplasty or a belt tummy tuck or a belt lipectomy. There are all these different names that float around. That's what makes it so confusing. But for me, a lower body lift is basically an incision that goes from the front to your hips and around to the buttocks.
Okay, great. And the difference between that and a tummy tuck?
Yeah, so with the tummy tuck addresses three areas. It addresses the tummy, as its name implies, the rectus muscle, the muscle underneath the abdominal flap, and then number three, the pubic region. So it's the tummy skin and the fat, the rectus muscle underneath, and the pubic region. Now the body lift addresses all three of those areas plus three more. The hips, the hip lift and reduction, the outer thighs because it lifts up the thighs like that, and the buttock. So it's basically 3 for the tummy tuck and 6 for the body lift.
Got it. Okay, and who's a good candidate for a tummy tuck?
Somebody that's lost a lot of weight. Maybe you've had gastric bypass, Roux-en-Y, vertical gastric sleeve, duodenal switch, etc. Or just diet and exercise, lost a lot of weight, and that skin doesn't snap back. We get a lot of urban myths. Oh, if you just lose the weight slowly, you won't need it.
Right.
Or, that's not true at all. Basically, if you have skin that doesn't snap back after weight loss, you're probably a good candidate for at least a tummy tuck. Now, there's some patients that don't lose a lot of weight and their tummy still protrudes. There are a couple of reasons why the tummy can protrude. It can be loose skin, where the skin just sags and it doesn't snap back. It can be a lot of excess fat underneath the skin, or number three, the rectus abdominis muscle is weak and it's just distended. It looks sort of like you're pregnant. That can be either due to the weak muscle or it can be due to the fat behind it pushing out. So those are candidates for a tummy tuck.
Okay, got it. So if you see the guy with the beer belly, is that a good candidate?
Depends. Okay, so that beer belly, again, could be loose skin. We don't know. Maybe it lost 100 pounds, 200 pounds, etc. Maybe it's just a thick layer of fat underneath the skin, or maybe the skin's great, he doesn't have any fat, and the belly just distends because the muscle is weak. So I have a lot of physical trainers that are actually teaching classes, and they're in front of, 50, 100 people telling them what to do and bike faster and Zumba faster, etc. But their tummy still sticks out. And that's not due to loose skin. It's not due to excess fat. It's due to weakness of the abdominal muscle. So we just go in and with a tummy tuck, we fix the muscle and get them a nice flat tummy, excise a little bit of skin, excise a little bit of fat, and get them a nice bored flat tummy. And in those cases, it's the weakness of the muscle. So it really depends on the patient.
Yeah, and a lot of moms come in after giving birth with that weakness of the muscle, and that's also rectus diastasis?
Rectus diastasis is separation of the muscle.
Oh.
Now we talk about the rectus abdominis muscle. It's a paired muscle that goes from the bottom of your rib cage down to the pubic bone, and they're one on each side. It's paired. So when you think of like those six packs that you see on the male and female athletes, you have a definition of 1, 2, 3, 4, 5, 6. Those are two paired muscles with three muscle bellies. That's why you get the six pack. And rectus diastasis is the rectus muscle that has been separated. So maybe it's been separated by weight gain, weight loss, or maybe it's been separated by twins or triplets where the tummy sticks out and the muscle actually separates.
Okay.
And it's very difficult for that muscle to sort of get back together. So with rectus diastasis, that muscle is sort of separated, and with the tummy tuck, when we repair the rectus, we're repairing the rectus muscle and the diastasis, bringing those muscles back together.
Got it. And when you do that muscle repair, you end up bringing in the waistline by like 4 to 6 inches usually.
Yeah, so it really depends on the patient, but you know, if the muscles have been separated and you have this love handle area, we can really snatch that in by bringing the muscles together.
It's crazy how quick those inches come off once you do that, though.
Yeah.
And it's permanent.
Permanent. I use permanent suture because most patients want a permanent result, right? And with those permanent sutures, we can get a nice hourglass figure sometimes, but we're really bringing in the waistline when we plicate the muscles together.
Right, and if you use dissolvable sutures, it wouldn't stay together. The muscles don't fuse together, right?
Correct. So some plastic surgeons, I don't know why they use dissolvable stitches, absorbable stitches on the rectus repair. And the rectus muscle, because of the fascia, really doesn't form good scar tissue. It really needs those permanent sutures to keep everything together. So if you use dissolvable stitches, the dissolvable stitches stay in place, the muscles are plicated, then the muscles are in place due to the suture repair, but once the sutures dissolve, because they're resorbable, the muscles then separate because the scar tissue that they form is not strong enough.
Okay, got it. All right, so back to body lift. So with the body lift, you get all that in the tummy tuck that you just mentioned.
Correct.
Plus the backside.
Plus the backside, exactly. So I'll get some patients that say, do I need a body lift and a tummy tuck? I'm like, wait a minute. The tummy tuck is inclusive of the body lift. Right. So with a tummy tuck, you just get a tummy tuck. With a body lift, you get a tummy tuck, hip lift, and buttock lift.
That's like saying, do I get liposuction with my BBL?
Correct. A lot of people ask that too. Right. So, you know, BBL is a 2-part procedure. We got to get the fat, and then we got to transfer the fat. How do we get the fat? With liposuction. Yeah.
Okay, great. So we had someone that we were speaking to yesterday who said that she got a tummy tuck, pretty happy with her results, but when she sits, she still feels all this excess skin of her back kind of hanging over, and she wishes that she knew about the body lift, which would have extended and taken care of that for her.
Yeah. So when I consult with patients, I ask them what bothers them, you know, and they'll elucidate and sort of figure out what bothers them the most. And if it's the lower body, I'll ask them, you know, what bothers you? And they'll say, oh, the tummy. And in that usually is included the pubic region and the muscle repair. And then I ask them, well, what else bothers you? Well, my love handles bother me. So to me, that means, well, maybe we need to convert that tummy tuck into either an extended tummy tuck. And an extended tummy tuck means that just we extend the excision and the incision a little bit further back. Some patients it's a couple inches. Some patients, you know, we have to turn them on their side to get over the hip. Some patients it's a little bit more. And then I ask them, you know, does the buttock bother you? And if they say yes, I consult and advise them, well, instead of maybe just an extended tummy tuck, maybe we continue around the hip and then go to the top of the buttocks to take care of the buttocks, hips, and tummy in one surgery.
And what do you do if a patient comes in and they still want to have volume of the buttock and they still want an hourglass figure after the 360 body lift?
Yeah, so there are a couple of things you can do with the body lift. You can, number one, make the excision of the fat minimal on the buttock. So when I do my dissection, when I make my incision over the buttock, usually I'll go deep down to the gluteus maximus muscle, scoot down over the buttock, and lift that whole section. On some patients, we just go down underneath the skin and keep as much fat on the buttock as possible, okay? But a lot of patients, most weight loss patients, want a reduced buttock too. Depends on the patient, but a lot of them want a reduced buttock. So that's when we're excising fat. So you can keep the residual fat. Another thing you can do is during the body lift, you can do liposuction. Either liposuction of the tummy, the hips, sometimes the buttocks, sometimes liposuction on the inner thighs, the outer thighs, etc., wherever we can find fat, and do a fat transfer at the same time, okay? There's a secondary procedure. Maybe we're healed up from the body lift and we're doing the upper body at a second stage. We can do a fat transfer to the buttock at that stage, or we can in fact do buttock implants, which also do very well.
Okay, got it. And we also do the pubic lift and reduction, which is a huge part of the surgery.
Yeah, I include that in my procedures. I mean, most of my weight loss patients, male and female, the pubic region is affected. So I really don't like it when I hear from patients, oh, I consulted with another plastic surgeon, and they're going to do a tummy tuck, but they're going to charge me extra to do the muscle plication, and they're going to charge me extra to do the pubic work. And I'm like, well, that should be part of the surgery because that part is all affected. So, in my tummy tuck quotes and consultations, that's included.
And people actually on Real Self are asking about just doing a Mons lift or reduction because they had a tummy tuck and it wasn't included.
It wasn't addressed, yeah.
It's so sad to see that because now they have to go back in.
And they have to have another surgery.
Right,
yeah.
And it's through the same exact incision, right?
Usually yes. So when we're doing pubic reductions, usually it's a horizontal incision that we do with the tummy tuck. And we go in and I take out like a fist size area of fat underneath the pubic region and also raise and reduce the skin. However, on more extreme cases, we need to make vertical incisions down into the pubic region to get rid of that extra skin. But those are the more complicated ones.
Got it. And there are some people who have a lot of their fat in the pubic region too. It just depends on
the patient.
Yeah.
Depends on the patient. So some patients, the fold of skin from the tummy covers the pubic region, and then some patients also have a secondary fold in the pubic region that covers the pubic region even more. And I get very annoyed with the insurance companies which, to approve a tummy tuck or a paniculectomy, the pannus, the abdominal flap, has to cover the pubic region. But on some patients, the pubic region is so big with excess skin and fat that it doesn't physically allow for the tummy flap to cover the pubic region. So the insurance then disqualifies those patients, and that's really not fair.
Oh, that sucks.
Yeah.
Okay, and let's talk about costs a little bit. We know that no one's costs are the same or right across the board, but does this tend to go by the patient's size, how long the surgery might take?
Yeah, it's multifactorial. The price of surgeries is very dependent on your geographic location. Are you having the surgery in a very urban setting? Are you having it in a rural setting? Are you having it done by a plastic surgeon that does it almost daily or weekly or monthly or yearly? Do we have an insurance component to it? Is part or all of the surgery covered by insurance? Are you doing it in a hospital? Are you doing it in a surgery center? Are you doing other body components with it? Is it going to be a 4-hour body lift like I've done sometimes, or is it going to be a 13-hour body lift for a complicated case? So it really depends on the timing too. So all those factors go into the quote. It's like asking, what's the price of a car? Well, there are a lot of different kinds of cars out there. So, and there are a lot of different geographic neighborhoods in the U.S. and the world. So, of course, there's going to be variability on the price.
And let's talk about who's the best candidate, especially after weight loss.
Yeah, after weight loss, your weight should be stable. If your weight is fluctuating, I would say more than 20 pounds up or down, you need to wait on the body lift or pretty much any plastic surgery procedure. So your weight needs to be stable. You need to be healthy. Your diabetes needs to be controlled. Your blood pressure needs to be controlled. You cannot smoke. Okay, so you need to stop smoking for my patients for at least 3 months before you think about a body lift.
Why is that?
Great question. So many problems with cigarette smoke. One, it causes cancer, and that's not good. Two, for plastic surgeons, what nicotine does is nicotine in cigarettes causes vasoconstriction. Okay, so that means you got your arteries, you got your capillaries, you got your veins. Nicotine works on the veins, and it causes the veins to constrict. Okay, so when you have a constriction in the pipes, oxygen being carried by the blood is not getting to the tissues because the tissues are being constricted by the veins. So oxygen's not getting delivered to the tissues. So in plastic surgery, we're pulling and tugging and putting things on maximum strain. And if you have nicotine in your system fighting against the delivery of oxygen, there's a much higher chance of things dying, skin dying, fat dying, flaps dying. So that's why we do not like nicotine at all.
And in general, if someone is trying to heal from anything, would nicotine it would
actually make it much worse.
Wow.
So
most people don't know that.
Well, they should. I mean, cigarettes have a big warning label on it, and some
they know it's bad. They know it causes cancer, but they don't realize that it's like preventing them from healing.
Absolutely,
and everything else
absolutely. It also, and it's the nicotine primarily. It also carries nitric oxide, which is a free radical, which damages a lot of the tissue. So cigarettes are really bad for you. So some patients, in their effort to quit smoking, will use nicotine patches or nicotine gum, which again is really bad because the culprit in plastic surgery really is the nicotine. So the patches and the gum are actually maybe even worse. So if you're going to quit smoking, just quit it. Some patients also are like, oh, I don't smoke, I just vape. Well, vaping has been proven to be even worse than cigarettes in terms of the delivery of smoke and cancer cells and stimulating cancer cell growth as well as nicotine delivery. So don't vape either.
Got it. So for weight loss patients, we get a lot of people who come in and say, you know, Dr. Katzen, I lost 100 pounds, but I want to lose 40 more, but I've plateaued. What do you recommend at that point?
Yeah, so sometimes that happens. Often that happens. So patients will have their procedure, gastric bypass, Roux-en-Y, duodenal switch, vertical gastric sleeve, lap band, etc. And they'll lose a lot of weight, 100 pounds, 150, 200 pounds, and then their weight will plateau. It would be great if it's their ideal body weight, but a lot of the times it's not at their ideal body weight and their weight just plateaus. And no matter what they do, they can't get that weight to drop. Okay, so they're exercising all the time, they're eating correctly, and unlike patients that have not had gastric bypass, no matter what they do, they cannot lose weight. Their weight just plateaus. So for those patients, they still may be candidates for plastic surgery. So even though your weight may not be the ideal body weight, or maybe your weight is 20, 30, or 40 pounds higher than you had wanted it, go consult with a plastic surgeon. Okay, he or she will examine your weight loss history and determine if, you've hit that plateau and it's unlikely that you're going to lose more weight, or maybe there are some things we can do medically. Maybe there's some prescriptions we can give you, things like Ozempic, which can help you lose even more weight.
Got it. And also, you guys resect a good amount of skin and fat.
True.
It will pretty much contract unless you lose another, 100 pounds?
Correct. So as we said yesterday during an interview, it's very rare that I've had patients in almost 25 years now lose so much weight after their body lift or their tummy tuck that we have to redo it. Because the amount of tension that we put the incision and the amount of skin that we resect should be enough, if you do lose more weight, to further shrink wrap around you. So again, it's unlikely that you need sort of revisions on these areas.
Great.
Because of further weight loss.
Right. Okay, that's awesome. Good to know. In our next podcast, we're going to be talking about if you need to be at your ideal weight for a body lift or other plastic surgery procedures.
Okay.
So we'll see you next week.
See you next week.
Thank you, Dr. Katzen.
Thank you.